Welcome to today's COVID-19 update. We're speaking with the Honourable Minister of Health, Dr. Frank Anthony, about the Ministry's COVID-19 vaccination campaign in Region 10, Upper Demerara, Berbice. Has the response to the COVID-19 vaccination improved in Region 10?
I think we're still getting a lot of hesitancy in Region 10. We have noticed that for several months now. While we do get a few cases every day of persons coming to get themselves vaccinated, it has really been a trickle. We have on average about 10 to 15 sites operating in Region 10, but on an average we're getting maybe between 50 to 100 people coming for vaccination. We will, however, continue working on this to make sure that persons who want to take the vaccine can have easy access to the vaccine, especially in Region 10. No, I think in a lot of the other regions, most people have come forward and get their vaccines. This is kind of peculiar to Region 10. And it is also, we are finding some challenges in Region 8 as well, in some communities in Region 8, where in some of those communities, persons are citing religious beliefs. But, you know, we have to keep working with them. We have had members of the different faith community going into those villages and talking to the religious leaders in those villages and trying to persuade them about the importance of getting vaccinated. Well, remote villages, or any village for that matter, are getting any one of the vaccines that we have. We had said earlier that we'll use the J&J in some of those villages because the J&J vaccine is a single-dose vaccine. However, we now know that it is recommended that someone who would have gotten the J&J vaccine 52 days after, it's advisable that you get a second or a booster dose. So what we were thinking about by giving that single dose and not going back to that community because you would have given the vaccine and you would have completed the process. Now we have to rethink that approach because most of the vaccines are really 2 doses, and if we give a J&J, we'll probably have to go back 52 days after to give a second dose. So whatever vaccines we currently have, we are making them available. As you know, we have opened up the Pfizer vaccine, and so in all the regions where we're right now operating in, and that people can go there and get the Pfizer vaccine as well.
Right, thank you, Minister. I know now anyone 12 years and older can get the Pfizer vaccine.
So if they have active malaria infection, we'll have to treat the malaria first and to make sure that they get better. Once they're better, then about 14 days after, then we can give them the vaccine. Because we do that with any infection. We don't want to give vaccines while somebody is infected with another, whether it's a virus, a bacteria, or a plasmodium in the case of malaria.
That's it for today's COVID-19 update. For more information, do log on to our website, dpi.gov.gy, or the Ministry of Health's website, health.gov.gy, and our social media platforms as well.